I guess you can see this. Yeah. Okay. So let's start. Today I'm going to discuss my thoughts regarding a new research project that I'm currently working on, and it's about the working condition in the community movement in Quebec during the COVID-19 pandemic. And the aim of the presentation will be to portray the consequences of the political policies and program put in place in the emergency of the pandemic. And in doing so, I'll identify several issues raised by these programs and public decision, and I will also try to offer a critical analysis on the deployment of unpaid work in the community-based movement and based on the theoretical work of Simonet. So first of all, the independent community action in Quebec is a movement that has become somewhat institutionalized. It has been recognized in 2001 by the government of Quebec. An important aspect of its recognition is the recognition of freedom of action of the community movement and its independency from the government. This means that even if the community organizations are mainly funded by the government, they can choose to fulfill their mission as they see fit. And to ensure this, the government funding is divided in three categories. So the first one is funding to the overall mission, which is the part that offers full liberty of action to the organization. Then you have funding for the services that complement public services, which organization may or may not choose to apply for. And you have the third one that is funding for short-term project. And the last two ones aren't recurrent fundings. This being said, I think it's important to specify that not all community organizations in Quebec are considered independent community action organization, and that since 2001, there have been many demands to increase the amounts allocated to the community movement fundings, in particular to the mission, and this leads to what is now known in the community movement as the chronic underfunding. And one of the consequences of this underfunding is the overall precarity of the working condition in the community movement. Previous research I led with Yannick Noiseux and four other community partners has demonstrated that workers in the community movement were suffering from financial insecurity, mainly because of low wages. This was also corroborated by another study led by Sophie Meunier, that shows that more than 20% of the workers in the health and social service community organization consider themselves as working poor. Our research also have shown that because of the financial insecurity of the organization, workers were suffering, to use the economist Guy Standing typology, from job insecurity, according to which they never really know for how long they will hold their job. And another struggle that is crucial is the overload of work. Again, this other study led by Meunier has shown that even before the pandemic, 1 out of 5 workers in the community movement experience professional burnout. And our study has shown that the community movement is aware of that situation, and that in order to reduce the workload, boards of directors offer to hire more staff. The challenge, though, is that many organizations don't necessarily have recurrent fundings, and this leads to the multiplicity of statuses, of work statuses, and the increased use of part-time jobs or even short-term contracts, or the hiring of independent workers. And the irony, though, is that by creating non-permanent jobs, the permanent worker workload hasn't necessarily decreased. And this is because those workers have to be trained, and also because new projects are continuously introduced due to the project funding. And finally, because new projects aren't necessarily ended when short-term contracts workers leave. And it's important to note that our study also has shown that the working condition of non-permanent staff are more precarious and can tend to pull down the general working conditions in the community movement. And finally, another crucial finding of our study is the existing tension in the community movement between, on one part, fulfilling the mission of the organization, and on the other part, maintaining or improving the working condition. And this tension is felt by management, but also by the workers themselves. And all this being said, we have to keep in mind that those previous results seems to be amplified or reproduced during the pandemic. So what happened during the pandemic? Even on the first day of the pandemic, the community movement was at the center of the governmental responses. On many occasions, governments, both federal and provincial, asked the community movement to step in order to respond to emerging needs created by the lockdown or its socioeconomic impacts. For example, we can think about the shelter for homeless people, the organization intervening in food security, organization concerned with domestic violence also. And community organizations have been present. Not only they have maintained activities and services when possible, but they also have increased their offers and transformed their practices to respect health guidelines and to respond emerging needs. And as stated by CETROC, which is a coalition of organizations, even if community organizations were receiving governmental funding, they weren't under any legal obligation to maintain services. In fact, each organization had the right to stay open or not, taking into consideration their mission, their resources, and the wishes of personnel and board of directors. And we have to note that sometimes the decision to maintain or even increase services and activity has been taken without taking in consideration the impact on working condition, or better said, knowing the impact on working condition, but also feeling that same tension between offering good working condition and answering needs. So the first month of the pandemic was challenging for the community movement. On March 20th and 21st, the community movement thought the governments had understood their needs. On March 20th, Health and Social Services Minister Danielle McCann thanked the community movement for doing such essential work. And the day after, the Premier, François Legault, recognized the need to get more people working for the community, so in community organization. And he said he was considering offering some new fundings to do so. In April, the federal and provincial government also put in place emergency funds for the community movement, but it hasn't been easy since. More or less a week after the announcement about the needs in the community movement, Legault changed his mind, trying to respond community movement requests by promoting digital platform called Je Bénévole, I Volunteer. And this platform was a way to coordinate the offer and needs around volunteer work. And this time, Premier Legault publicly announced that the community movement were lacking staff because volunteers were over 70 years old and they were respecting governmental guidelines to stay at home. And this was, in his word, the reason why there was an urgent need to fill those spots and why he asked unemployed people to do volunteer work. And this argument, reducing the needs in the community movement to the lack of volunteer, has also been mentioned by the federal government. In an official document explaining different fundings offered for the community movement, it was clearly written that those funding were in part helping to, and I quote, resolve the volunteer labor force shortage. So this deployment of unpaid work in the community movement during the pandemic has had several impacts on the working condition of paid staff. First, it increased health risk because having a diversity of people turning up for work, it increased health risk. And then it also increased the workload. Even a week after the call to volunteer, the TNCDC, which is another coalition of organizations, confirmed that the number of volunteer workers exceeded the capacity of organization. And community movement also noted that a lot of people who were offering time were in fact people who themselves needed help, people feeling lonely or needing psychological support. In fact, the community organization didn't have the time to coordinate or even form, supervise, and support an important number of volunteers. And then came the emergency funding. Those fundings, again, in themselves increased the workload. It was bureaucratic, was passing by intermediates. It required more work just in order to know where to apply, fill the application, and then do the accountability. And in some cases, for example, in domestic violence, the money wasn't even accessible in June, so months after the start of the emergency state. And the funding also oriented the community organization encouraging them to focus on offering services in accordance with the governmental priorities. And this can be criticized if we refer to the freedom of action reivindicated by the community movement. And then again, those emergency fundings, it offered, offering better working conditions to staff wasn't a priority. More than that, most of them didn't even allow hiring new staff or improving working condition. And all this in a context where the need to retain and recruit workers was recognized by the government. And furthermore, that even the precarious working condition in the community movement were recognized. It has been said openly when Legault was announcing the initiative program to retain essential worker, what we call the PIRT, and he directly named the community movement workers as precarious. Yeah, and then I would like to discuss another program, is the Summer Canada Job Program. It's a federal program which already existed and was improved during the pandemic. To describe it shortly, the program is offering short-term contracts within the minimum wage salary in order to promote the professional insertion of students. We also have seen this idea promoted by the federal government to offer scholarship in exchange for doing volunteer work in the community. Even if it didn't come true because of all the charity scandal, this was a way to compensate students offering less than minimum wage, emphasizing on professional experiences they can get, and more than that, on values of social implication. So all this offered by the federal government isn't that far from the call to volunteer made by the provincial government. This time, not only the government was appealing to values and deploying unpaid or underpaid work, but it was also referring to community movement job as a way to enter the job market. And again, I have to insist, this kind of professional insertion program increased the workload of other workers. So this being said, I hope that by now it is clear that all those decisions and those public policies and programs we discussed have direct impact on the working condition in the community-based organization. And those decisions seem to have precarized even more those working conditions by not offering a possibility to improve working condition of existing paid staff, for example, or also by increasing the amount of work that has to be done. And it also revealed the deployment of unpaid work in the community movement and the fact that the community organization had to count almost exclusively on new workers, on professional insertion program and volunteer. And this implied taking into consideration not only what we can call the privatization of public services, but also, as proposed by Simonet, the gratuitousness, la gratuitisation of public services. And the community movement have to think about this because this brings a lot of questions. So for example, who is doing the unpaid work and what the repercussion of the deployment of this unpaid work on paid staff working conditions are. Because by giving the impression that everyone that is motivated by value is skilled to work in the community movement, isn't this contributing to the unrecognition of competences or even its naturalization of them? And the fact that the community movement is looked and promoted by the state as a good place to enter job market, isn't this contributing to the precarity of the working condition? And those are serious questions, and they need to be taken into consideration by the community movement in a context where it seems harder every day to recruit and retain staff. And moreover, the community movement must think about what it means to be an independent community action movement, where again, it seems clear that government is counting on the community movement to offer services, because without the freedom of action and without the possibility to maintain alternative practices, isn't the community movement just offering services that the state choose to subcontract, profiting on cheap labor that is motivated by value? And well, I'll end with those sentences because I see time, but I think that if we don't think about this possibility, maybe the independent community action movement is going directly there. So